Hi, everyone. Good morning. Today, I'm joined by Dr. Per Gasland, a pediatric hospitalist at the University of Utah Health and Intermountain Primary Children's Hospital. He oversees Germ Watch, which is a tool created by Intermountain Healthcare and the University of Utah Health to help the public understand Utah's communicable disease trends, symptoms, and general information about treatment. Today, we're going to be talking about a rise in RSV cases and if there's any concern as to what will happen come the fall. Thank you so much for joining us. It's nice to have you. I appreciate it.
Thank you for having me.
Of course. So I want to start out with kind of setting the stage. We've talked about RSV in the past, but will you explain to people what RSV is?
Yes, of course. RSV stands for Respiratory Syncytial Virus. The syncytial part of the RSV name speaks to what this virus, this respiratory virus, does when it gets down into our lungs and infects the lining of our lungs. Similar to actually SARS-CoV-2, measles, and a couple other viruses, once those viruses infect those cells, they can cause those cells to fuse together and pull off from the lining of the lungs. And if you look at them under a microscope, you'll see these big fused collection of cells. So that's where that description comes from. RSV is an extremely common respiratory virus that we deal with every year. And in fact, was part of the reason why we created Germ Watch in the first place many decades ago, to help keep track of this illness, as it has a substantial impact on the children of our communities and therefore on what happens up at my place of work, Primary Children's Hospital.
And will you explain a little bit too around how RSV is actually transmitted? How are people getting this virus? And also what ages of people typically are getting this virus as well?
Of course. So respiratory syncytial virus, RSV, is in the family of what you might call common cold viruses. And for a lot of people, it does just cause a common cold. But for certain populations, RSV can change and evolve from just congestion, cold symptoms, to infections involving the lower parts of the lungs, in particular the bronchioles, and can even cause pneumonia. So RSV is famously known for causing a condition called bronchiolitis in children under 2 years of age, in particular between 6 months and 2 years of age, that can cause a lot of secretions, coughing, increased work of breathing, need for oxygen, that type of thing. So RSV tends to be very hard on the very young. It can also be hard on elderly folks, people older than 65, in particular if they have lung disease or heart disease. And it can also affect people in the middle that have underlying conditions that can be exacerbated by viral infections, things like asthma or even congestive heart failure.
I feel like a lot of the times you hear parents of newborns talking about not kissing your baby to not get RSV. Is that typically the way that the virus would get passed around, or can it be as common as like being in the same room as someone with RSV?
Yeah, so as we've all become somewhat experts in viruses and how they get transmitted in this past couple of years, RSV is thought to primarily be transmitted by droplets, meaning that you cough, you sneeze, you create these droplets, they hang in the air, they either get inhaled or they can settle on surfaces. So that's the droplet transmission. It can also be transmitted by fomite transmission, when those droplets land on surfaces or utensils or cups, and you touch those surfaces, then touch your eyes, your nose, your mouth, and you can get infected with RSV that way. Unlike some of the more dramatic respiratory viruses, chickenpox, measles, and SARS-CoV-2, COVID-19, we don't think that aerosolization, those really tiny particles that hang in the air for long periods of time, are a primary method by which RSV gets transmitted.
So I want to talk a little bit more about the trends that we're seeing here at Primary Children's Hospital. Can you tell us about both RSV and the COVID-19 trends we're seeing up at the hospital?
Yeah, so RSV, we didn't see essentially any RSV last year, which was common across the country. In the last several weeks, we've started to notice our counts of lab confirmed cases of RSV start to tick up, much like we've started to see our counts of COVID-19 tick up and gradually start to tick up in children as well. So we're watching this very closely because we're concerned that those trends are going to really pick up and we're going to start to see a lot more disease. As of right now, the counts we're seeing in terms of the total number of cases that are detected in our labs, those numbers are similar to where they might be for RSV about a quarter of the way into our season, which are typical season starts in late November, December, usually really picking up steam into January. So our lab confirmed levels are sort of what we might see in early January as we're starting to buckle down as a hospital and get ready for a surge of patients with respiratory illness. We've seen a slight trickle uptick of patients getting admitted to the hospital with RSV, sort of scattered throughout the state. Some of them even sick enough to wind up in the ICU. But right now, things are looking okay, but the next several weeks, that's probably going to change. For COVID-19, we're starting to see sort of a steady trickle of pediatric patients, some with underlying medical conditions, others that are otherwise fairly healthy, but showing up with more respiratory illness. We didn't see a lot of that last spring, but we're starting to see some more of that now.
You said that the levels too are that of January. Why do you feel like RSV is starting to circulate so early this year?
So let me be clear, this RSV happening like it's happening right now is extremely unusual. We're not the only place in the country that has been seeing that. In fact, some of our colleagues in children's hospitals throughout the country, especially in the South, have seen a pretty significant and dramatic uptick in RSV, including admissions to their hospital, also coinciding with upticks in their COVID-19 admissions as well. So it's unusual for RSV to show up like it is at this time of year at these types of levels, but it wasn't something that has caught us by surprise because we saw what was happening to our fellow hospitals around the country. It's also not unusual for us to have our RSV season start a little bit later for somewhat unclear reasons. It tends to sort of start in the South and in the East and then kind of spread its way across the country. So we were expecting that we'd start to see this and have been monitoring it very closely. As to why we're seeing RSV activity in the middle of the summer, both nationally and at the Children's Hospital, our best guess is that these viruses are around at certain levels. So they're just waiting for the opportunity to jump out and infect our children and the people in our community. And as the efforts and the things put in place to help control the pandemic started to get loosened up and people started mingling together and mixing together, that virus had a chance to start spreading around and take hold in our communities.
Someone just asked a question. Do you think it's possible that the wildfire smoke in the valley has anything to do with the uptick in RSV?
That's a terrific question. What we know from doing studies in Utah and looking at our epidemiology of RSV and influenza and other respiratory viruses is that there's a pretty strong correlation with that type of viral activity, in particular more severe lower respiratory viral activity with the air quality and the particulate matter in the air. So typically in Utah, when we see our deep inversions where the air quality is bad for sustained periods of time, that tends to correlate with an increase in emergency department utilization and hospitalizations for these types of respiratory illnesses. So it's certainly logical and realistic to believe that the wildfire smoke certainly isn't helping the situation with RSV. The idea behind that is you have all this irritating, inflammatory particulate matter that gets down into your lower respiratory tract. So you get inflammation. You may be more susceptible to infection. You may be more susceptible to severe infection because of disruption of the normal mechanisms that help you clear those viruses out of your lungs. So it's certainly possible. The other part of that is with the deep winter time recessions is often really, or inversions, the conditions are such that it's colder outside, you're spending more times indoors, the kids are in school, there's a lot more mixing of people and a lot more opportunity for disease to spread.
Someone else just asked a question around testing for RSV versus COVID-19 as well. How do we tell, or how do you tell as a doctor what the difference is between the two?
Well, I think that's one of the big problems, Amanda, that we're facing and will be facing in the next few weeks. The evolution of the COVID-19 virus, specifically the Delta variants, and its tendency to have more prominent cold-like symptoms and typical respiratory symptoms is bringing it into a position where those symptoms really overlap a lot with respiratory syncytial virus, RSV, and other respiratory viruses. So there's a lot of shared symptoms right now, and really one of the only ways for us to tell the difference between these infections, especially in the early phases, is by doing testing. Luckily, our testing capacity has really picked up and is really solid, and our ability to test for both viruses at the same time with a single test has really been solidified. So we're able to pick those up if you're able to get to a place that can do that type of testing. But if you're at home and trying to sort this out in your family, does my kid have RSV or do they have COVID-19? It may be very hard to do so without getting a test.
I want to talk about last year a little bit, and we've talked about this in the past. Last year, there was no cases of RSV in Utah last winter. What are some explanations for what was happening last year? And could we take some of what we learned last year and apply it to now as well?
Sure. Well, it was really a remarkable thing as the pandemic started to unfold and schools were shut down and social distancing measures were put in place and people started wearing masks that RSV and influenza that were still around at pretty decent levels that time of year just basically vanished and disappeared and went away. While it's hard to know for sure, the best thinking and the best people looking at this think that it's pretty much because we put those measures in place to try to limit the spread of the pandemic. Secondary benefit being that it limited the spread of the usual respiratory viruses that we see during that time of year. The downside of that is that normally in a given respiratory season through that winter period, these viruses tend to circulate, they tend to infect who they're going to infect, and by the end of the year, the population has a certain level of immunity against those viruses. Then when you take those measures away and people start getting together again and mixing together and these viruses can hop in, you're going to have a larger pool of people that are going to be susceptible to that virus. And so you may see pretty quick uptake or uptick in activity and mini epidemics, if you will.
A question around that as well. You mentioned that last year we were wearing masks, we had precautions in place. Do you recommend that children wear face masks still if they feel like they're at risk for RSV or COVID? Is there any suggestions or advice you have for parents as school starts in just a few weeks?
Right. I know this is a contentious and now politically charged topic, and that's somewhat unfortunate. As a pediatrician and as a parent of children who's also sending my children back to school imminently, I think because the large population of children that are still susceptible to COVID-19, especially with the Delta variant raging, and now with RSV starting to pick up as well, I think there's a really, besides the COVID-19 argument alone, I think there's a really strong argument to be made for putting masks on our children when they go back to school. So why is that super important to me? Well, I don't want people to get sick and die unnecessarily. I also think there's a real chance that a surge in COVID-19, a surge in RSV might start to line up, and then you really start to put additional strain on the healthcare system and the people taking care of these patients that are getting sick enough to wind up in the hospital, who are already sort of exhausted and in some places understaffed, that you really put additional strain on the healthcare system that could be avoided. Masks aren't perfect, but they're really, besides immunizing children over 12 years of age for COVID-19, masks are really, and social distancing and hand washing are probably really the best tools in our toolbox to try to, slow the spread, take those sharp peaks that are potentially possible with COVID-19 and RSV coming at the same time and trying to flatten those out.
You mentioned that it's spiking right now as well. Do you expect this spike to continue if we don't change measures at all?
Yeah, so with schools going back into session and large groups of kids that are vulnerable to COVID-19 as well as RSV, and having large pools of susceptible children going back to school, I think it's most likely, going to get worse, potentially substantially worse before it gets better. And boy, starting off, the school year with immediately kicking off a whole bunch of COVID-19 and RSV cases is probably not going to be optimal for successfully keeping our kids in school. So actually, I think putting masks on kids, having them be in school that way and trying to be distanced and controlled as much as possible. I'm a huge proponent of getting kids back into school, but let's do it in a smart way that keeps us safe and keeps us all healthy.
I want to switch to adults and RSV. You mentioned this a little bit earlier that it can be RSV can be dangerous to people who are older. What about those who are immunocompromised? Specifically, someone mentioned if they have had cancer or recovering from cancer. Are there any concerns for those people as well with RSV?
Yes, absolutely. Those are the types of people that I would put into the high risk for getting severe illness with this respiratory virus. Being real old, really small, premature, people that are immunocompromised, people with underlying lung and heart disease, people with asthma, especially poorly controlled asthma. Those are the people that we see getting in trouble with RSV.
And do you have any suggestions for adults that are different at all from children, or do you feel like if you're one of those people that fall into that high risk category, wearing a mask and just being a little bit more cautious, washing your hands can help mitigate your risk as well?
Well, I think if you're in that category and I would go even a little stronger than a little more cautious. I'd say you need to be really cautious. You already probably need to be really cautious for COVID-19, but boy, RSV is not a fun thing to get either and could make you very sick. And masking, arguably, for those populations is even more than just a regular sort of surgical mask or a face cloth covering. Those are patients that are a population of people that would probably even benefit from better respiratory protection, like wearing an N95 mask if you need to go out into public, to go to the grocery store, to go anywhere where there's a gathering of people.
You mentioned this a little bit about stuff that we've learned from last winter, but what are some specific things that you'd like to continue practicing now to prevent RSV in toddlers and infants that we've kind of learned from last year?
Well, I'd like to imagine that there's a whole bunch of school-aged children out there that have sort of learned to wash their hands really well, do it for a good period of time, learn to tolerate being in masks, learn in families that are attentive to my kid seems kind of sick. Maybe I shouldn't be sending them to school if they're ill. So all that stuff can go a long way. I do really think that masks in those types of settings are probably one of our best ways to stay safe. Since it's been long enough that we've seen RSV, there's also some special populations of children that can benefit from a preventative medication, specifically very premature babies, those born under 29 weeks of gestational age, babies that were born maybe a little bit later, say 32 weeks, that needed oxygen and have what we call chronic lung disease from prematurity, and then certain babies that have significant congenital heart disease. That's a population of kids that we have a medication for, a monoclonal antibody that we usually ramp up and deliver during the winter season and have systems in place for that. But as of the last couple of weeks, seeing the level of RSV activity that we're seeing now, we're trying to roll that out in summer, which has some logistical challenges, but we're trying to get those patients now identified and start that medication because it can prevent them from having really severe disease and winding up in the hospital. So those are a couple of suggestions. I also think if you are one of those people that is at risk for severe disease from RSV, asthmatic, congestive heart failure, that it's probably good to make sure you have a fresh supply of your medications, your controllers, your inhaled steroids, your relievers like albuterol, and make sure you're maybe even touching base with your primary care physician to have sort of an action plan for what you're going to do if you get sick.
Question along those lines too. We just actually got this question and I was going to ask you, but at what point should I take my child to the doctor? What symptoms should I be looking for RSV and COVID? And when does it become this, I need to go seek help moment?
Yeah, so tackling that at a high level, these are colds that start with congestion, cough, can fairly quickly get into the lower respiratory tract infection. Once you start to have that involvement in your lower respiratory tract infection, there's often difficulty breathing, fast breathing, struggling to breathe, nose flaring out, using the neck muscles, retractions between the ribs, below the ribs. So if you're seeing difficulty breathing in your infant or child, that's something to be seen for. Another reason to be seen is if you're child is not feeding very well, poor intake, starting to get worried about dehydration. That's an important reason to get seen. High fever lasting more than a few days is another reason to make sure you get checked out, to make sure you haven't developed a complication like pneumonia or an ear infection, things like that. Any kind of rash, any kind of change in their demeanor, how they respond, and certainly any signs of blue lips or blue discoloration suggesting that they're not getting adequate oxygen. All those things would be reasons to seek care pretty quickly. The argument to be made for COVID, even though kids generally haven't been getting all that sick, that may be changing. We're starting to see, more kids throughout the country filling up hospital beds. Again, trouble breathing, concerning fever types of changes. And then it may be worth getting tested to sort of sort this out, because I think it's going to be really confusing if you have like regular respiratory viruses circulating as well as COVID, and they can look a lot alike. That there may be a good argument to get tested so that we can make better decisions about having you stay home when you're sick and what kind of risk may be posed to other family members that may have been exposed to whatever virus you wind up with.
With testing as well for both RSV and COVID, are parents able to go to their pediatric doctor for that? What are your suggestions for testing?
Generally, they can, but it's worth a phone call beforehand to make sure, because they may direct you somewhere else. Obviously, there's now test kits that you can test for COVID at home. That's helpful. There is no such thing for RSV. RSV testing needs to be done in a clinical setting.
Do you have any last advice for parents or even just caretakers and people in general around how to keep kids and themselves safe from RSV and COVID as we go into the fall season?
Well, I would say acknowledge that we're all pretty tired of the pandemic, a lot of fatigue with that, and certainly us in the healthcare delivery settings are definitely feeling that. We were all pretty optimistic that, summer was going to be great. We're going to be heading back into school and we're going to be dealing with this. But the reality is we are. There's a lot of Delta variant circulating in Utah. Now we have these other respiratory viruses. So if we can rally, especially as we send our kids back to school, to continue with some of the stuff that we know that works, social distancing, hand washing, mask wearing. If you're one of those people that's held out for whatever reason on getting your COVID vaccine, I encourage you to go do that as soon as possible, because that's one of the main ways we're going to get out of this mess. And those are my big take homes. Is a plea to let's try to rally together as a community to keep each other safe and healthy. And while we try to get our kids back to school so they can be educated and emotionally happy and safe, and hope that we can do that together as a community to minimize how much more illness and suffering we have to see heading into this fall.
Well, thank you so much for all the advice and for taking the time to talk to us. I really appreciate it. And if anyone watching has any questions around RSV or anything like that, they can go to Intermountain's Germ Watch website. I will put the link for that specifically into the Facebook Live afterwards. Also, if you're not vaccinated or have questions about the COVID-19 vaccine, you can go to intermountainhealthcare.org/COVID vaccine. Thank you so much again, and we'll talk to you later.